Our Peers Empowerment and Navigational Support Project is a peer health navigation program to improve health and healthcare access for people with disabilities. A collaborative team of academic, clinical, and disability community partners designed OP-ENS to help break down barriers to health and healthcare access faced by people with disabilities. Within OP-ENS, we take a broad view of health to include not just what happens within the healthcare or medical system, but also concerns related like transportation, food security, housing security, and community engagement. OP-ENS employs peer health navigators, people with disability with specialized training, to guide people through the structured process of rapport building, identification of needs and priorities, goal setting and action planning, all while providing ongoing emotional support and practical information. The OP-ENS intervention is 12 months long, and peer health navigators meet with their participants monthly at least. This gives people time to build meaningful relationships and tackle a variety of issues related to health and healthcare access. Peer health navigators meet regularly as a group with the clinical coordinator to problem solve and learn together. The OP-ENS program uses this as an opportunity to strengthen this intervention by learning from what is happening in the community. Here are our navigators. They each bring rich and diverse lived experiences to the group and to their work within the OP-ENS program.
Hello, my name is Ron. I am a 60-year-old African-American male. I became a peer health navigator in the OP-ENS program in 2017. In 2009, I suffered a traumatic spinal cord injury due to an automobile accident. The result was a fractured spinal column with incomplete paralysis. At the time, I was a 14-year veteran of the United States Postal Service. My injury stopped all of that. I initially felt lost, helpless, and depressed. However, through much hard work, I did recover. I started as a wheelchair user and then moved to using a walker, and now I use a cane. The OP-ENS program allowed me to reinvent myself. By contributing to the disability community, all is well.
I am Mr. J. I am a middle-aged African-American man with multiple sclerosis. I am very well adapted to my condition. I reside in an independent living building that allows me to live in dignity and safety. I am active in a nearby church. I have a personal assistant that visits me several times a week and assists me with daily chores and personal care. I sought guidance from the OP-ENS program because I was frustrated with the multiple layers of the healthcare system. For example, insurance agencies, my agency who found my PA, and my physician-patient relationship. I have found it hard to navigate finding an appropriate personal assistant.
As a way to accommodate Mr. J, I would occasionally visit him in his home for our monthly contact. On this particular home visit, the following interactions occurred. Hey, Mr. J, how have you been doing? Anything new going on?
I've been okay. The program's been very helpful for me. I'm glad you could come by. I appreciate the home visits because it can be an all-day event to have to come out to your office.
No problem at all. I'm glad the program is helping you. Let's review your accomplishments and future goals. Also, we need to review our timeline. We will need to be in our 12-month conclusion in a few months.
Okay. Well, Ron, I do have an issue that I want to talk to you about. I'm having a problem with my personal attendant.
Tell me about it. I can see that it's bothering you.
Well, there's a communication problem with my PA. I'm not satisfied with their performance around my home. They're not getting things done that I need, such as cleaning or preparing my meals. She just mostly sits around watching TV with me, or she's on her phone playing games or talking. I don't want to lose the help or cause a problem, so I don't say anything. She's a nice person.
Well, I understand your dilemma, but it already seems to be a problem. First, you need to realize that your PA works for you. This is her job. She is getting paid to work for you, not just to be here to keep you company. Unfortunately, it sounds like she's taking advantage of you. I suggest that you approach this like an employer to employees relationship. If you're not satisfied, let her know. If no change, then contact the agency and report the problem. It's the agency's responsibility to make sure you have a good PA and that you're satisfied with the job that they are doing. You will not lose your right to have a PA so long as you're not being unfair or disrespectful towards them.
Oh no, I'm not being rude or anything like that. I'm just not saying anything about it. I have a good relationship with my caseworker. That's who helped me get a PA. Should I call them and talk to them about it?
Yes, that's a great idea. I also suggest that you get a clear idea about what your responsibilities are with your PA and a clear idea of what the PA's responsibilities are. But like a good employer, you have to make sure that you give your PA all that she needs to be successful in her job, like cleaning supplies, foods that you want prepared, etc. And be sure to let her know that you appreciate her work and that she's doing a good job.
I like that idea, Mr. Ron. I like that approach of employer to employees relationship. I didn't think about it that way. I will put together a list tonight and show her when I see her.
I also suggest that you put together a specific plan or list of duties that you want your PA to address every time that she is here. But remember to be sure that your requests are within her responsibilities. Clear your list with your caseworker first.
Okay, that's a good plan, Mr. Ron. I'll get right on the list and contact my caseworker. I'll keep you posted on my progress on this matter. Before I forget, I have another problem that I need to talk to you about.
Okay, Mr. J, put it on the table.
Well, Mr. Ron, as you can look around my apartment and see, I don't have a lot of furniture in here. And more specifically, I don't have a really comfortable chair to relax in. I spend most of my time in this wheelchair and watch TV or read. I want to know if the program can help me and get in a more comfortable chair. Something like a lazy boy or a recliner.
Wow. Well, Mr. J, I don't think the OP-ENS program is budgeted to provide furniture for our peers. But I do understand your situation. I'm sure a nice new lazy boy would be nice to have. I'd like to have a big leather recliner too, with a heated massage built in from my back and all kinds of remote features.
It doesn't have to be all that.
Well, just thinking, what about your association with the MS Society?
What do you mean, Mr. Ron?
I remember seeing a Multiple Sclerosis Society magazine you had. Why not contact them and ask if they have any donation type programs that might be able to help you find some kind of chair? You never know.
Well, I guess I could give them a call.
Good. It can't hurt. Sometimes you have to think about the groups or associations that you have already been working with. But the OP-ENS project just doesn't have those resources yet. Here's another idea. What about calling your church?
Now that's a good idea, Mr. Ron. I hadn't thought about them.
How about contacting your pastor directly and ask about if they have any programs or ministries that could help? My church has a bulletin board that has all kinds of postings on it.
Yes, I believe we have one too. I will definitely call my pastor and ask.
Good talk, Mr. J. Let me know how that turns out. Always try to remember your resources. The OP-ENS project is just one of them. Think about all the other organizations and contacts as potential resources that you could possibly use in the future. A major objective of the OP-ENS project is to empower our people to research and advocate for yourself. Start developing that toolbox of people, places, and things that you can use as your go-to for different issues and concerns.
Well, thanks again, Mr. Ron, for your support and suggestions. I am thankful for the assistance that the Opens Project has given me. I'm going to miss it when it's over.
I'm glad that it's been helpful, but I'm sure you'll be just fine.